Hi everybody, my name's Professor Diane Fatkin and I'm a cardiologist at the Victor Cheng Cardiac Research Institute in Sydney, Australia.
Hi everyone, my name's Renee. I'm a cardiac research clinical coordinator and I'm a cardiac genetic counsellor, and I work with Diane at the Victor Cheng Cardiac Research Institute.
So we're absolutely thrilled to be joining you today as part of the 2021 SciFam conference. And what we'd like to do is to talk about how Titin affects the heart and to tell you about some of the research that we're doing in this area. So the disease that we're focusing on is called dilated cardiomyopathy. And this is a heart muscle problem with a ventricle, which is the main pumping chamber of the heart, enlarges and the pumping action comes weak. And this can cause a lot of problems, including heart failure and abnormal rhythms of the heart. And why this is relevant to the meeting today is that genetic variations in the giant Titin gene are a major cause of dilated cardiomyopathy. The problem is, of course, that all of us carry many thousands of genetic variations in Titin. And so one of the challenges for researchers is to figure out which are the important ones and which are not. So Renee, what can we say about Titin variants and how can we work out which ones are likely to be a problem for the heart?
Thanks, Diane. Like you said, all Titin variants aren't the same, and we're still learning a lot about Titin variants as we go. And when I'm talking about Titin variants, I'm really talking about spelling mistakes in our DNA, and our DNA is the code book of life that tells us how we're put together. And we're talking about a really specific type of spelling mistake or variant that causes the Titin protein to be shorter than it should be. And this Titin protein is what helps make up the heart muscles. And because it's shorter, it can't do the job it's meant to do as well as it should do. And when we're looking at it, we know that, like Diane said, a lot of people have these types of variants in Titin, among other variants that we see. And one of the ways that we can look at this is we can look at how frequent they are, so how common they are found in the general population. So does anyone else in the world have that same variant that doesn't have this particular heart condition? And we can also look at the location. And we know that there are certain parts of that Titin gene that have spelling mistakes that are more commonly associated with dilated cardiomyopathy than we see in the general population. So they're two of the best ways at the moment that we can look at Titin variants and try to determine which ones are likely to be causing heart conditions. But we also know that there are other factors. So Diane, what other factors are we normally looking at when we're talking about Titin in the heart?
So this is actually a very important question and is something that we're actively researching into at the moment, because what we've found is that even patients who carry the same type of Titin variation in the same part of the Titin molecule can present in very different ways. And so we have a one end of the spectrum, young people presenting with heart failure. The other end of the spectrum, we have elderly people walking around with almost normal heart function. So we think that there's other factors that are unique to individual patients that are acting together with the Titin truncation to determine how severe the heart muscle dysfunction is and what age it occurs. And some of these factors might be things like whether you're a boy or a girl. Age is definitely a factor. Other illnesses may come into the mix. And then, of course, there's a whole heap of lifestyle factors that may be important. Things like how much alcohol you drink, whether you're inactive, whether you're overweight. And so all of these things are things that we're actively as part of our research. And this is really important because if we can pinpoint the factors that make Titin truncations more severe with respect to the heart function, then we can advise people to avoid certain things. Whereas if we can identify factors that might be protective, then that allows us to give positive lifestyle recommendations to our families.
So Diane, if I was found to have a Titin variant, what should I be doing?
Well, the main thing to do is to take it seriously and go and see your doctor. So, as we've said, not all Titin truncation variants are equal. So the first thing to do is to sort out whether this Titin truncating variant is likely to be a problematic one. But say if it is, then it's important to see a cardiologist who will then not only take a history to see if there are any symptoms that's suggesting of heart dysfunction, but the critical test is an echocardiogram test. And this will allow us to actually look at the pumping action of the heart and the size of the heart chambers to see if there are any abnormalities present. And the doctor may also do an ECG, which allows us to look at the electrical activity of the heart. And one of the things to bear in mind is that if you have one normal echocardiogram, it doesn't necessarily mean that your heart function is going to stay normal. So for our patients who are found to carry a genetic change in Titin that is important, we suggest an ongoing, periodic repeat of the echocardiogram to see if there are any new changes that develop over time. And the aim of that is to nip these in the bud with early onset of therapy. But while we're talking about screening, you know, Renee, if, say, a mum or dad of a patient who had one of these nasty congenital skeletal titinopathies, if one of them was found to have a Titin truncation and they went to their doctor and had their clinical screening, does it stop there? Or what are the implications for the relatives of those people, and how far does the screening really need to go?
That's a really good question, Diane. When we're talking about genetics, we're usually not talking about an individual patient, we're talking about families. And so if you or your child's been diagnosed with a Titin variant, we would recommend telling your close, or what we call first degree relatives. And when I'm talking about that, what I mean is your parents, your siblings, and any children in the first instance. And we'd be asking them to consider having genetic testing to understand their risk. And they may or may not be interested in this, but we would definitely want them to all have clinical screening as well. So similar to what Diane was just talking about previously. And then if, say, somebody's parents were found to have that variant, then that would then go on to further expand the screening from there. So their close relatives, so their parents, if they were still alive, their siblings, and any other children as well. And so it sort of expands outwards from there. But generally in the start, we're really talking about your close relatives, so your parents, your siblings, and any other children. And if you do need help, genetic services are quite well used to talking to families, and they can often give you some tips or some help in getting that information out to relatives as well.
So the take-home message is that Titin is a very important cause of heart disease. And so it's very important that patients and families get screened. But although we've learned a lot about Titin truncations and heart disease, there's still an awful lot that we still don't know. And this is why we're busy in Australia doing research on this topic. So we'd love to hear from you if anybody's got any questions, or if you'd like to contact us by phone or email. We're very happy to talk to anybody with about our research and how to manage Titin truncations. Thanks very much.
Thanks for your time.